Assalamualaikum warahmatullahi wabarakatuh. We are from group 7 and for the assignments we are gonna talk about a complex disease called systemic lupus erythematosus. Our team member consists of 4 people, which me, Nukrato Aini binti Abdul Razak, Kohiro Baria binti Muhammad Zanaini, Wano Irayu binti Wan Aziz, and Nur Syafika binti Samsuddin. For introduction, systemic lupus erythematosus (SLE) or commonly known as lupus is an autoimmune disease which the body immune system mistakenly attacks healthy tissue in many parts of the body. Symptoms vary among people and may be mild to severe. Lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. The most distinctive signs of lupus is facial rash that resemble the wings of butterfly unfolding across both cheeks, occur in many but not all cases of lupus. Some people are born with a tendency toward developing lupus, which may be triggered by infections, certain drugs, or even sunlight. While there is no cure for lupus, treatments can help control symptoms. As you can see on the slides, this is a lupus facial rash that resembles the wings of butterflies.
So for the clinical manifestation, first is fatigue and headache, ulcer, butterfly rash, joint pain, hair loss, pleurisy, photosensitivity, Raynaud's disease, and weight loss or gain.
Next is management. There are 2 management for SLE patient, which is medical management and surgical management. So firstly, for medical management, we have lifestyle modifications. So firstly, for lifestyle modification is regular exercise. Regular physical activity can improve physical and mental well-being, reduce fatigue and depression, and also enhance cardiovascular health. Example for regular exercise is walking, swimming, yoga, and cycling. So next is balanced nutrition. Balanced nutrition can support immune function, reduce inflammation, and maintain a healthy weight. So we need to eat balanced diet rich in vitamin D and avoid of certain foods such as fast food because it can trigger SLE symptoms. So next is eat plenty of fruit, vegetable, and whole grain. Include omega-3 rich food, fish. So next is sun protection. Protecting skin from sun exposure is crucial, as lupus can become worse by sun exposure. So we need to use broad spectrum sunscreen such as SPF 50+, and also wear protective clothing like hats and long sleeve. And lastly, we need to avoid direct sun exposure, especially between 10 AM to 4 AM. For medical management, they also have pharmacological. So number 1 is hydroxychloroquine. It is a disease-modifying anti-rheumatic drug that can relieve lupus symptoms and slow down how they progress. It also can decreasing the activity of the immune system. Next is non-steroidal anti-inflammatory drugs NSAID. It is used to manage pain, swelling, and fever associated with lupus. Example for NSAID is ibuprofen. Next is immunosuppressant. Immunosuppressant are medication that suppress your immune system and used for more severe cases, particularly when corticosteroids are not effective. They can help prevent tissue damage and inflammation. So lastly is corticosteroid. It is reduce inflammation and immune activity, often used during flare-ups to reduce it. Last but not least, for management is surgical management. There are no surgery to cure SLE. However, surgery may be used to treat some of the complications of SLE. For example, if lupus nephritis progresses to end-stage renal disease, renal transplantation can be considered. Additionally, surgical procedures like joint arthroplasty replacement may be needed for osteonecrosis or arthritis. As for renal transplantation, if lupus nephritis lead to end-stage renal disease, kidney transplantation may be considered as a treatment option. Next is joint arthroplasty. Total hip or knee replacement might be necessary if osteonecrosis or arthritis complication of SLE severely impact joint function. And lastly is arthritis. If patient develops arthritis, arthrocentesis can be done to relieve the joint and increase the patient range of motion.
Diagnosis for lupus is fatigue related to chronic inflammation as evident by verbal reports of tiredness. Objective, we have two types of objectives. First is subjective, verbal reports of tiredness and inability to complete usual activities. For objective, first observe decreased physical activity such as resting frequently or slow movement, having pale appearance or dark circles under eyes, decreased muscle strain on assessment, change in a vital sign after exertion such as increased heart rate or respiratory rate. Next one, lab result indicating anemia that refer to low hemoglobin or hematocrit. And lastly, inflammatory marks elevated to ESR or CRAP. Easy intervention for lupus is assess the level and pattern of fatigue regularly. To monitor severity and identify contributing factors such as pain, sleep disturbance, and evaluate change over the time. Next one is encourage energy conservation technique. Examples such as prioritize tasks, schedule rest period between the activity, sit instead of standing when possible. Rationalize for help prevent over exertion and manage limited energy level. Next one is promote balance between activity and rest. The rationale is adequate rest prevent that can worsen of fatigue, while mild activity may maintain muscle strain and circulation. Next one is encourage light physical activity such as tolerated, such as short walk. It can regularly low impact activity that can reduce fatigue and improve overall well-being without straining the body. The next intervention is promote adequate nutrition and hydration. For rationale, proper diet support energy levels and help the body manage inflammation. Next one is monitor and manage contributing symptoms such as pain, sleep disturbance, or depression. This often worsen fatigue. This factor often worsen the fatigue. So if we can control it, it can improve energy levels. Next one is educate patient and family about the nature of lupus related to fatigue. Increase understanding to the family patient, and then support a realistic expectation and encourage support from others. Last one is coordinate with other healthcare providers such as physical therapist, dietitian, or physician. For rational, multidisciplinary approach can better address complex causes of fatigue.
In conclusion, systemic lupus erythematosus is a complex autoimmune disease with a wide range of symptoms and clinical manifestations. While there is no cure, early diagnosis and comprehensive management through pharmacological treatments, lifestyle modifications, and supportive nursing care can greatly improve a patient's quality of life. A multidisciplinary approach, including regular monitoring and patient education, play a key role in minimizing flare-ups and other complications. By understanding lupus and implementing tailored intervention, we can help patients lead more stable and fulfilling life.